It has been 5 days since most COVID-19 health orders were lifted in Kentucky. Masks are still required on public transit, in schools, and in long-term care facilities. But last Friday, Governor Andy Beshear said COVID-19 remains a threat, although the Commonwealth is no longer in crisis. Alongside the governor at that briefing, and at really just about every other one, was Dr. Stephen Stack, the commissioner for Kentucky's Public Health Department. So he is with us now live by Skype right now. Dr. Stack, most of us are returning to our pre-pandemic lives. That feels good to say, but still less than half of Kentucky's population is vaccinated. My first question for you, I guess, is there any concern about or threat from being out without masks in groups, being back to normal?
Well, Evan, thanks for the opportunity to be here. So it's an incredible success to have this many Kentuckians vaccinated so quickly. There's still more work to be done, though, as you point out. We still have half the population who has to get vaccinated. To that point, we have the Shot at a Million campaign, and I'd encourage everybody to go out and get vaccinated for your own protection, but also to sign up at the shotatamillion.ky.gov website, where you have a chance to win $1 million each of the next 3 months. Or if you're 12 to 17 years old, there are going to be 5 lucky young folks who get the chance at a full scholarship to go to college here in Kentucky. So we need people to get vaccinated to keep ourselves safe, and there are plenty of opportunities to incentivize you to do that as well.
If we're out enjoying our bars and our restaurants or going to events that are finally happening, if we're vaccinated, it's all the honor system, right? Is there any concern or threat being in groups with people that we just don't know?
So the vaccines are incredibly protective of you if you are vaccinated. So, for example, in the last 3 months, in March, April, and May, 97% of the people who got sick with COVID were unvaccinated. 94% of the people who went in the hospital with COVID were unvaccinated. 92% of the people who died in the last 3 months from COVID were unvaccinated. If you get vaccinated, you have incredible protection. So please, for yourself, your family, your loved ones, get vaccinated. For the others, they have chosen at this point not to get vaccinated, and they can become infected. They can suffer the consequences of the disease, and they can spread it to others. So if you still feel you're vulnerable, you have to take extra steps to protect yourself and determine what settings you go into and whether you choose to continue to wear a mask or not.
That's one of the things I hear from a lot of my friends who are young parents, right? Their kids are younger than 12, still can't get the vaccine. Do you have some advice for them, best practices, maybe folks who are immunocompromised and haven't been able to get the vaccine yet? What should they be doing, or should they be taking precaution?
Right. So for children under 12, they still can get infected. Thankfully, children under 12 are in probably the lowest risk category for any significant or ongoing harm. It doesn't mean we shouldn't take it seriously, and they can still get infected and spread it to others who are more vulnerable. If you have immunocompromised conditions, you're on medications that blunt your immune system response, you probably should still take extra care and precaution, and that may mean you just don't go into settings where you are particularly close to people you don't know and whose vaccination status you don't know. And again, all along this journey, we've urged people to be patient and kind and tolerant with each other. If someone's wearing a mask, we all need to respect their choice to wear a mask. They may be doing that to keep themselves or someone else safe. It's important that we continue to support them as they do the best they can to stay healthy.
So it's great that it's warm out and we're all outside now, but you look down ahead to the fall and the winter further down the line. Is there anything that concerns you or that we should be on notice about there, or are we truly on the road to being normal again?
So we have shown, and thank goodness for the scientists who did such great work, we have shown this is a vaccine manageable condition. If you get vaccinated, it works incredibly effectively. So folks need to do that. As we enter into the fall and the winter, and we're still in the beginning of the summer, but as we enter into the later parts of the year, hopefully a lot more people will have been vaccinated as they've seen how effective they are, how safe they are, and just how much they've enabled us to get back to the lives we've missed. And so in your counties up in northern Kentucky, and Boone, Kenton, and Campbell, you've got higher vaccination rates than the general state at large. So kudos and congratulations to northern Kentucky for showing the way. 2 of your counties are in the top 5 for the state. We need them to continue to show the way and encourage more people still to get vaccinated.
We've touched on this a little bit when we were introducing you here, but you've had a busy year and a half helping manage the response to COVID-19. Are there any particular moments that are going to stick with you years from now, whether they be a high or a low, anything you would have done differently?
Yeah, it has been a privilege to serve. It's been one of the most exhausting things I've done over this journey in life, but it's been one of the greatest privileges without a doubt. I have seen so many acts of kindness and caring and concern for each other, people who send me nice thank you notes, people who look out for their neighbors and their families, people who have done their very best to keep all of us safe, including themselves. The things I'll remember from this is just what a privilege it has been to serve our state and its people, and what a wonderful opportunity it's been to serve alongside the governor and Cabinet Secretary Friedlander as we've done the best we can in difficult circumstances to support the entire state.
You know, if you didn't know him before, you certainly do now. The work is not done quite yet. Dr. Stephen Stack, the commissioner for Kentucky's Public Health Department there. Dr. Stack, thank you so much for taking a little bit of time here to talk with us about this pandemic and where we go from here, because we're still going to be talking about this for a long time.
Thanks for the opportunity, Evan. I hope you have a great summer.
Thank you. You too.